No matter what you take away from our session today, the most valuable lesson I would like to say is to be kind. Be kind to the people that you're sharing your house with, the people that you're confined with. Be kind to your neighbors, be kind to strangers. Just be kind. The more that we can be there for each other, the more that we can spread positivity, and the more that we are realizing how connected we are, the more that we embrace that we're here for each other and really just sharing our planet, including the animals that we share it with, just sharing it with everybody on this planet, and sharing that warmth and just kindness, I think will take us the longest way. So please be kind. Was coronavirus created in a lab? So the answer to that is no. I think that's just giving humans too much credit. Coronavirus is actually a virus that has been present and has been causing the common cold for a really long time. So this is a virus that we are aware of that already existed. Viruses naturally can mutate with time. So this, what we're calling COVID-19 or the novel coronavirus, is a new type of coronavirus, but coronavirus has been existing for a long time. Can garlic and turmeric, can they help me to prevent getting coronavirus, COVID-19, or help me in improving my immune system so I don't get it, or even helping and treat it? So there have been studies that have been done that have proved garlic and turmeric to have antimicrobial properties. With that said, anything beyond moderation can be dangerous. And second, we have not tested these with the COVID-19 virus. So I cannot say for sure that they would prevent or even treat COVID-19. You have to be mindful that our body needs good nutrition, healthy food, fresh vegetables, fruit. Those are all very important. Those are things we can do to boost our immune system. You want to exercise, even if you're at home, get creative. Maybe learn that workout routine that you've always wanted to try. Meditate, deep breathing. So these are ways that you can increase and strengthen that immune system as a line of defense against the virus. I wouldn't rely on herbal supplements at this time. I wouldn't try to take anything in excess. If in fact, we are putting our pets and animals at risk. So if you have symptoms, if you have tested positive for the coronavirus, please take precautions when dealing with your animals and your pets. Wash your hands, do everything that you would do while dealing with a human. Please take care of our animals. Stray animals need love and care. They need food. This is a time, again, like I said, to be kind and to be patient. So not only should you be looking out for humans, you should also be looking out for all the animals. At this point, we have no evidence to prove that humans can get the coronavirus from domesticated animals. Is this virus going to go away as the temperatures start warming up? So traditionally, viruses like influenza, yes, they can be seasonal. As months get warmer, you tend to have less outbreaks and less spread. But with this COVID-19 virus, we just don't know yet. We don't have that information. I live in Houston. It is extremely hot over here, and it is also humid. And I can tell you we do have cases of COVID-19. There's patients that have it, who have the virus, but can be completely asymptomatic. There's other people that get the virus, but they have very severe symptoms and very severe disease. So what we're seeing is patients that are older, greater than 65 years of age, or patients or people that have comorbid disease like high blood pressure, glucose, sugar problems, heart disease, chronic lung problems like asthma. Yes, they tend to have more severe disease. With that being said, we've seen it both ways. I've seen healthy individuals with severe disease, and I've also seen patients that are older that have just had mild symptoms and were able to fight it. So at this point, we're still learning about this. It is novel. We are still acquiring data and information. And what I would recommend is all of us practice social distancing, all of us practice hand hygiene, all of us practice all the necessary precautions that our local authorities, healthcare professionals, the CDC, the WHO are recommending, because as we learn more information, the situation will continue to evolve. And I would say if you're going into a public setting where maintaining social distancing is not in your control or not possible, I would recommend wearing a mask. Now, the most important thing about wearing a mask is removing the mask. So yes, you put it on, but when you come home, the process of removing the mask is actually more crucial than anything else. You want to make sure when you're removing this mask, you take it off, you put it either to get washed or you dispose of it and you wash your hands immediately. If those same hands are not cleaned and washed, then you're just spreading the virus or the potential of those germs everywhere and pretty much counteracting any kind of productivity that was gained by wearing it in the first place. Say you work at the hospital, a lot of us have been going out, let's say just to do groceries, but we're not sure if those surfaces have the virus. Would you recommend that we leave our shoes outside the house and not bring them indoors? Are there any recommendations or anything, any advice for people on what to do with their shoes and how to protect yourself from getting the virus?
I think again, the we just don't know if that's enough to cause an infection, but prevention is going to be what we need to do here. So if you feel comfortable keeping your shoes outside, I think that's great. Washing your clothes when you walk in the house, just keep continuously washing your
If you
hands
have a hand
because
sanitizer, you want it to be at least 60 to 90% alcohol based. That's number one. And number two, just using warm water and soap can do wonders. So if you have access to warm water and soap, I would prefer that you use warm water and soap to wash your hands. And in scenarios where you don't have access to water and soap, then rely on your hand sanitizer. I've heard a lot of people making hand sanitizer at home. Again, there's just no data right now to support whether this method is reliable or not. Do not have a cure for coronavirus COVID-19. There is no cure. Antibiotics don't work for viruses, they tend to work for bacteria. A lot of people asked if the medication that's used for the influenza virus, which is Tamiflu, could work for the COVID-19. Well, that's a great thought. And coronavirus is also a type of virus, similar, and so is influenza. The same medication wouldn't work because they're both different viruses. They are both viruses, but they're both different viruses. So the same medication, as of now, we don't have any evidence to support that it would work.
there is something that's being tried called convalescent plasma. What it takes is, I think Kanika mentioned it earlier, basically it's take antibodies or proteins that have already fought the virus in somebody else who's been infected and then trying to inject those proteins into somebody else. Um, there has been some evidence from China that shows it might work, but we still don't know enough about it to guarantee or to be sure that it's working. So it's going to take a lot of science, a lot more experiments before we have any idea that it's working. It's still too early to tell.
Misinformation. Misinformation is a culprit of panic, of anxiety. And in a time like this pandemic, we cannot afford for misinformation to create more chaos. So I urge you to be responsible. I urge you to look out and really seek that evidence and the data in everything that you read. Don't forward these messages. Don't spread misinformation because it really, really can be toxic in a situation like this. It's very heartbreaking that a lot of patients or a lot of people are getting very aggressive towards their doctors. They don't want to follow guidelines. I know staying at home and being isolated is difficult, but we need you for this. A lot of us are risking our life and are going to take care of our patients, whether it's in clinics or hospitals. And my husband is one of those people that is going to the front lines, taking care of our patients. So please listen to your healthcare providers. We are here for you. We're all a team. And please be kind.